If rice is on your plate several times a week and you have never questioned whether you are eating the right kind, this video is going to change something for you today. Because there is one type of rice that most seniors have never tried that contains more protective antioxidants than blueberries, that a 2026 clinical study conducted specifically on older adults found reduces dangerous inflammation in just 8 days, and that protects your arteries, stabilizes your blood sugar, and may even sharpen your memory. And the best part? You cook it exactly the same way you already cook rice. Stay with me. Hello and welcome back. I am Dr. Carter, and for over 30 years, I have worked with older adults just like you. Men and women in their 60s, 70s, and 80s who are doing their best to stay healthy, stay active, and protect the body they have worked hard to maintain. And one of the most common conversations I have with patients in this age group goes something like this. Doctor, I eat reasonably well. I watch my portions. I take my medications. Why does my cholesterol keep creeping up? Why do I feel so tired after lunch? Why does my stomach feel bloated after meals that used to be fine? The answer, in many cases, is not what they are eating. It is what they are eating instead of something better. And for people who eat rice regularly, that something better is what I am sharing with you today. This is not about a complicated diet change. This is about one simple swap that takes the same time to cook, costs just a few dollars more per month, and delivers a completely different level of protection to your heart, your arteries, your blood sugar, your gut, and your brain. Backed by research done specifically on older adults. If you want honest, verified, senior-focused health content every single week, please subscribe to this channel right now. We are here for you every week. Let us get into this together. What is black rice and why were seniors in ancient China living so long? The rice I am talking about today is called black rice. You may also see it labeled as forbidden rice, purple rice, or emperor's rice at your health food store or grocery, all the same grain. And those names carry real history worth understanding. For thousands of years in ancient China, black rice was considered so therapeutically valuable that it was reserved exclusively for royalty and the emperor. The general population was forbidden from eating it. That is where the name forbidden rice comes from. In traditional Chinese medicine, it was used as what practitioners called a blood tonic, a food that nourished the body, strengthened the organs, and supported long life. Today, modern science is confirming what those ancient practitioners observed through generations of use. This rice is not just a grain, it is a functional food. And the reason it is so different from ordinary white rice is something called anthocyanins. Now, I know that is a word that sounds complicated. So let me make it very simple for you. You have already seen anthocyanins your entire life. They are the pigments that make blueberries blue, eggplant purple, and red cabbage red. They are nature's most powerful group of antioxidants, and black rice contains more of them per serving than blueberries. That deep, beautiful purple-black color is not decoration, it is medicine. What anthocyanins do inside your body after 60. Let me explain why anthocyanins matter so specifically for your age group. Because what happens in the body after 60 is different from what happens at 35. And understanding this changes how you think about every meal. As we age, a process called oxidative stress accelerates in the body. Here is the simplest way I know to explain it. You have seen what happens when you cut an apple and leave it on the counter. Within minutes, the surface turns brown. That is oxidation in action. Free radicals, which are unstable molecules produced by normal metabolism, stress, pollution, and processed food, do something very similar inside your body. They damage blood vessel walls, they damage cell membranes, they damage DNA, and over time they drive chronic inflammation. Chronic inflammation in older adults is not the kind you feel from a sprained ankle. It is a quiet, low-grade, persistent fire burning throughout the body that you often cannot feel at all. But it is silently accelerating aging, stiffening arteries, disrupting blood sugar regulation, and increasing the risk of heart disease, stroke, cognitive decline, and cancer. Antioxidants are what the body uses to put that fire out. And anthocyanins are among the most powerful antioxidants found in any food. Every time you eat black rice, you are sending a concentrated wave of these protective compounds into your bloodstream, where they go directly to work, neutralizing oxidative stress and calming inflammation at the cellular level. And this is not just nutritional theory. A landmark clinical study published in the journal Food and Function in January 2026 studied older adults specifically. Researchers gave participants black rice for 8 days. They measured their blood markers before and after, and what they found was significant. Blood levels of interleukin-6, which is one of the most important and widely measured markers of chronic inflammation in the body, decreased significantly in the black rice group. This was not a reduction in young athletes or middle-aged adults. This was a reduction in older adults, people your age, eating real food, in 8 days. That same study also found improvements in verbal memory and cognitive recall in the older adult participants. The researchers concluded that the cognitive benefits appeared to be directly connected to the reduction in inflammation, because elevated inflammation in the brain is now recognized as one of the primary mechanisms behind age-related memory decline. What black rice does specifically for your arteries and heart. Now let me talk specifically about your arteries, because this is where the impact of black rice becomes most personally relevant for adults managing cholesterol, blood pressure, or cardiovascular risk after 60. Here is something your doctor may not have had time to fully explain. LDL cholesterol, the type commonly called bad cholesterol, is not actually dangerous simply because it is present in your blood. What makes it dangerous is when it undergoes a process called oxidation. Oxidized LDL is the form that becomes sticky, adheres to the walls of your arteries, and gradually builds up as the plaque that narrows your blood vessels and raises your risk of heart attack and stroke. And what causes LDL to oxidize in the first place? Oxidative stress. The very same process that anthocyanins from black rice directly counteract. A 2025 peer-reviewed review published in Agronomyjournals specifically confirmed that anthocyanins in black rice prevent cardiac diseases and atherosclerosis by inhibiting the accumulation of LDL in arterial walls. Research published in the Journal of Nutrition found that black rice anthocyanin extract enhanced plaque stabilization and reduced atherosclerotic plaque formation. And a comprehensive 2025 review in Springer Nature's Food Production and Nutrition Journal documented that black rice anthocyanins enhance HDL production, which is the protective good cholesterol, while supporting the body's clearance of excess lipids from the arteries. Cleveland Clinic nutrition experts reviewing the evidence on black rice specifically confirmed it is linked to reduced atherosclerotic plaque formation and helps maintain healthier total and LDL cholesterol levels. These are clinically recognized outcomes, not wellness blog claims. Institutional medical guidance. For seniors who are already managing cholesterol with medication, this is important context. Black rice does not replace your medication, but it works through a complementary and completely natural pathway to support the same goal. Less oxidized LDL means less plaque. Less plaque means healthier arteries. Healthier arteries mean better circulation, lower blood pressure burden on the heart, and reduced risk of the cardiovascular events that remain the leading cause of mortality in adults over 65. Important note for seniors on blood thinners or cholesterol medication. If you are currently taking blood thinners like warfarin, cholesterol medications like statins, or blood sugar medications like metformin, please mention this dietary change to your doctor at your next appointment. Not because black rice is dangerous, it is food, not a drug, but because it does have real and documented effects on cholesterol and blood sugar, and your doctor may want to monitor your numbers more closely as you make this switch. This is a simple and sensible conversation that protects you. Let me ask you something. Has your doctor mentioned your cholesterol or arterial health at a recent visit? And are you currently eating white rice several times a week without thinking much about it? If both of those things are true for you right now, this video was made specifically for you. Drop a yes in the comments if that describes your situation. I want to know how many people this applies to. Blood sugar, energy crashes, and what white rice is quietly doing after 60. Now let me address something that I hear from almost every senior patient I see. That tired, heavy, foggy feeling 30 to 60 minutes after eating a rice-heavy meal. Many older adults assume this is just aging. It is not aging. It is what white rice specifically does to your blood sugar. Here is the biology in plain terms. White rice has had its bran and germ layers removed during milling. What remains is almost pure starch, with very little fiber and almost no protective compounds. When you eat white rice, it digests extremely rapidly. Glucose enters your bloodstream very quickly. Your blood sugar spikes sharply. Your pancreas, which may already be working less efficiently after 60, rushes insulin to bring that sugar down, and then blood sugar drops, sometimes too quickly. That drop is what produces the fatigue, the brain fog, the cravings, and that heavy feeling you may have been experiencing after meals for years. Black rice is metabolically different in a way that matters significantly after 60. The fiber content of black rice is substantially higher than white rice, and the 2025 Springer Nature Comprehensive Review confirmed that black rice anthocyanins inhibit carbohydrate-digesting enzymes, meaning glucose enters the bloodstream more slowly, more gradually, and more gently after a black rice meal. The blood sugar rise is controlled, the energy is sustained, the crash does not happen, and your pancreas does not have to work nearly as hard to manage the response. Cleveland Clinic nutrition experts confirm that the phytochemicals in black rice improve insulin sensitivity, helping your body use glucose more efficiently. This means black rice supports the metabolic stability that becomes increasingly critical as we age, and our insulin response naturally becomes slower and less precise. For seniors managing prediabetes or blood sugar concerns, this distinction is particularly important. Choosing black rice over white rice at the same meal is not a minor nutritional tweak. It is a meaningful structural change in how your body responds to that meal at the metabolic level. What black rice does for your gut and your brain after 60. Two more benefits that I want to make sure you hear before we get to the practical guide. Both of them are particularly relevant to the concerns I hear most often from seniors. The first is gut health and digestion. Many adults over 60 deal with slower digestion, bloating after meals, irregular bowel habits, and general digestive discomfort that was not present when they were younger. The fiber in black rice acts as a prebiotic. That means it serves as food for the beneficial bacteria that live in your intestinal tract. A healthy, diverse gut microbiome directly influences immune function, mood stability, metabolic efficiency, and the level of systemic inflammation throughout the entire body. For older adults specifically, gut health is increasingly recognized as central to overall aging outcomes. When your gut bacteria are well nourished, everything connected to them improves. Your digestion becomes more regular. Your immune system becomes more responsive. Your mood and energy become more stable. However, and this is an important practical note for seniors, if you are increasing fiber intake and your current diet is relatively low in fiber, do not start with a full cup of black rice. Start with a quarter cup serving for the first 1 to 2 weeks. This gives your digestive system time to adjust gradually. Jumping immediately to large portions of a new high-fiber food can cause temporary bloating or gas, even from healthy foods. A gradual start prevents discomfort and helps you stick with the habit long-term. The second is brain health. The 2026 clinical study in older adults that I mentioned earlier found not only reduced inflammation, but also improvements in verbal memory and cognitive recall after just 8 days of black rice consumption. The researchers specifically concluded that these cognitive benefits were mediated by the anti-inflammatory mechanisms of the anthocyanins, particularly the reduction in interleukin-6, which is known to impair brain function and memory when chronically elevated. This is significant for seniors concerned about cognitive decline. A food that reduces the very inflammation associated with memory decline. A food that improves verbal recall in a measurable way in older adults. In 8 days, that is not a supplement. That is not a pharmaceutical. That is rice. I want to ask you honestly, have you noticed any changes in your memory or mental sharpness in the last few years? And have you experienced more bloating or digestive discomfort than you used to? Both of those things are connected to what we have been discussing today. Drop your experience in the comments below. You are not alone in this. And your honesty helps other seniors watching this video feel less alone too. Now let me give you the complete practical guide, tailored specifically for how seniors actually cook and eat. Because I know your needs are different from a 30-year-old following a fitness influencer. Step 1. Finding black rice. Look for black rice at health food stores like Whole Foods, Sprouts, or Natural Grocers. You can also find it at many Asian grocery stores where it is often labeled as forbidden rice, purple rice, or Chinese black rice. If you have difficulty getting to a specialty store, it is widely available online and can be delivered directly to your door. When selecting black rice, make sure you choose whole grain black rice, not pre-processed or instant varieties. Look for deep, dark, purple-black grains. If the package looks pale gray or lavender rather than deep, dark purple, the anthocyanins may have been reduced through processing, and you will lose much of the benefit. The cost is typically between $4 and $8 per pound, which makes many servings and is a very reasonable investment in your cardiovascular and metabolic health. Step 2. Preparing it for easier digestion and better texture. Here is a senior-specific tip that most recipes skip over, but that makes a real difference. Soak your black rice in cold water for at least 4 hours before cooking, or overnight if possible. Why does this matter specifically for older adults? First, soaking softens the grain significantly. Black rice is naturally firmer and chewier than white rice. For seniors with any dental concerns, partial dentures, or sensitivity to harder textures, soaking overnight produces a much softer and more comfortable result. You still get the nutty texture and the beautiful color, but without the hardness that can be uncomfortable for some older adults. Second, soaking reduces phytic acid, which is a compound that can interfere with the absorption of iron and magnesium, two minerals that older adults specifically need and that black rice provides. Soaking improves how efficiently your body extracts these nutrients from the grain. Third, soaking makes the rice gentler on the digestive system, which is particularly important if you have a sensitive stomach or are starting with black rice for the first time. Step 3. How to cook it. After soaking and draining, add 1 cup of black rice to 2 cups of water in a saucepan. Bring to a boil, reduce to a very low simmer, cover tightly, and cook for 25 to 30 minutes. The soaking will have reduced the cooking time from the standard 35 minutes. When the water is absorbed, turn off the heat and let it rest covered for 10 additional minutes before serving. The result will be a beautifully soft, warm, nutty, slightly sweet grain with a stunning deep purple color that signals to you that the anthocyanins are present and active. Step 4. How much and how often? For seniors, a realistic and effective starting portion is 1/4 cup for the first 2 weeks, then gradually increasing to 1/2 cup per serving. Most of the clinical research showing cardiovascular and anti-inflammatory benefits used consistent consumption several times per week, rather than large single servings. 2 to 3 servings per week is a realistic and evidence-supported target. You do not need to replace all your rice with black rice immediately. Mixing half black rice and half brown rice is a wonderful way to transition gradually, adjust to the flavor and texture at your own pace, and still get meaningful anthocyanin intake. Step 5. What to pair it with. Black rice has a naturally nutty, mildly sweet, earthy flavor that most seniors find very pleasant and easy to enjoy. It pairs beautifully with baked or grilled fish, particularly salmon or cod. It works well alongside roasted vegetables, steamed greens, or a simple stir-fry. It makes an excellent base for a warm grain bowl with whatever protein and vegetables you enjoy. For seniors who enjoy a warm breakfast, black rice porridge is a wonderful option. Simply cook it slightly longer with extra water. Add a small amount of unsweetened almond milk or regular milk, a sprinkle of cinnamon, and a few fresh or frozen berries. This gives you a warm, satisfying, anti-inflammatory breakfast that sustains your energy through the entire morning without the blood sugar spike of oatmeal made with instant oats or sweetened cereals. Step 6. An important note about medications. I mentioned this earlier, but I want to say it again clearly because it matters. If you are taking warfarin or other blood thinners, statins for cholesterol, or blood sugar medications like metformin or insulin, please mention this dietary change to your doctor. Black rice has real effects on cholesterol levels and blood sugar through its anthocyanin and fiber content. These are good effects, but they are real physiological effects, and your doctor may want to check your numbers after a few weeks to see how your body is responding. This is not a reason to avoid black rice. It is a reason to keep your doctor informed so they can support you appropriately. Here is your challenge for this week. The next time you do your grocery shopping, look for black rice. Just 1 bag. Try it this week. Soak it overnight. Cook it soft. Pair it with your favorite protein. And come back to this video and tell me in the comments exactly what you noticed. Did you enjoy the flavor? Did you feel different after that meal compared to a white rice meal? Did your digestion feel different? Your experience genuinely helps every other senior watching this video make their decision. I read every single comment on this channel. Let me bring everything together with 3 clear takeaways I want you to carry with you. Takeaway 1. Black rice is one of the most antioxidant-rich foods available in any grocery store. Its anthocyanin content exceeds that of blueberries. A 2026 clinical trial conducted specifically on older adults found that just 8 days of consuming black rice significantly reduced interleukin-6, a key blood marker of chronic inflammation, and improved verbal memory and cognitive recall. This is not a supplement. This is a whole food with documented clinical benefits in people your age. Takeaway 2. Unlike white rice, which causes rapid blood sugar spikes and energy crashes, black rice digests slowly, stabilizes blood sugar, prevents the mid-afternoon fatigue so common after 60, and protects LDL cholesterol from the oxidation process that creates arterial plaque. It also feeds the gut bacteria that regulate your immunity, mood, metabolism, and overall resilience. It is a fundamentally different food experience at the cellular level. Takeaway 3. Start small. A quarter-cup serving for the first 2 weeks, soaked overnight for a softer texture that is gentle on digestion and easier to chew. Work up to half a cup 2 to 3 times per week. Mix it with brown rice if you want to ease in gradually. And mention it to your doctor at your next visit if you take blood thinners, cholesterol medication, or blood sugar medication. The food you put on your plate every single day is either building your health or quietly working against it. This is one of the most simple, most affordable, and most evidence-supported swaps available to you. Same cooking method, same place in the meal, completely different level of protection for your heart, your arteries, your brain, and your body. You deserve food that works as hard for you as you have worked your entire life. This is it. If this video helped you today, please give it a thumbs up. It takes 2 seconds and helps more seniors like you find this information when they need it. Subscribe if you have not already and turn on the notification bell so you never miss a new video. Take care of yourselves. I will see you in the next video.